My name is Ghaddar from the University of British Columbia, and today I'm discussing new results in C3 glomerulopathy and idiopathic immune complex MPGN, two rare glomerular diseases with overlapping features and variable courses. In these conditions, prognostication has been difficult. Prior studies have been small, and the drivers of kidney outcomes have been unclear. Our aim in this study was to identify baseline clinical and histologic predictors of progression and build a practical risk model. So we assembled a cohort of 225 patients from 3 different centers that resulted in the largest cohort to date. We examined the association of clinical and biopsy findings and a composite outcome of significant eGFR decline or kidney failure. The key predictors of higher risk of kidney outcome were lower baseline eGFR, paraproteinemia, and interstitial fibrosis. Lower risk of outcome was associated with native disease rather than post-transplant recurrence, white ethnicity, and interestingly, lower C4 level. Proteinuria reduction has also told a powerful story. Patients who achieved at least a 50% drop from baseline to less than 1 gram per day had markedly lower risk, independent of other factors. This reinforces the use of proteinuria reduction to this level as a clinically meaningful target in both care and trial design. From these variables, we then built and internally validated a prediction model with strong performance. While it requires external validation, it moves us closer to individualized risk estimation in these rare diseases. For practicing nephrologists, these findings refine our understanding of prognosis and point to achievable treatment goals, even in diseases where therapeutic options remain limited. Thank you so much for listening, and we look forward to sharing more researches in the future.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.